Okay, hi, my name is Erica and I'm an MB student at UTEP. Today we'll be doing a neurological exam as well as a musculoskeletal on my patient Natalia here. So first we'll start with our neurological exam where we will assess the mental status. Prior to assessing your patient, make sure your hands are always washed, mine are. And the neuro assessment always starts immediately upon assessing the patient. So we are going to start with your orientation. So could you tell me your name? Your date of birth,
12/16/92,
and what year is it currently?
2023.
Okay, perfect. And then we're also, so we know that she's alert. We can see that just by the way that she's sitting, the ability for her to talk to me. She's looking at me, and there's no signs of drowsiness or anything like that. So we're gonna look at her language function, which we already assessed because she spoke back to me perfectly in English. Next, we can test her memory. So I could ask her a question like, what did you do last night?
I was at work.
How was work?
Busy.
Busy.
It was really busy.
And then we could ask, so that would be like short-term memory, long-term memory, like what did you do for your last birthday?
I went out to church bar.
And how was that?
It was
Great.
fun.
Okay, perfect. The next thing we could test could be something like, so we already tested memory, we could do calculation, so that's like numbers. So if you could count backwards from 100 to 50 by tens.
I did tens. So
Okay.
100, 90, 80, 70, 60, 50.
Perfect. And then we could also ask her about abstract thinking. So that could be like, if the house right now was burning down, what would you do?
Well, if we're in an enclosed space like this, the door's closed, I would feel if the door is hot, and if it's not, I'm running out of there. And then if it is, I'm jumping out this window.
Yes.
I'm grabbing belly.
And grabbing my dog. Yes. Okay, perfect. So that is a way to assess the mental status. Next, we're going to assess the motor system for any kind of involuntary movements. We're going to look at muscle bulk and muscle tone. So you want to do this with the patient relaxed. So go ahead and just sit up straight for me, relax. We're going to do this. So we're going to look at your involuntary movements, right? That would be tremors, tics, fasciculations. She doesn't have any, there's no kind of involuntary muscle movement. Next, we're gonna look at bulk, muscle bulk specifically. So that's just, again, inspecting the muscles. And we can see that there's no kind of atrophy, there's no wasting. The contours of the muscle are normal. We can't see any kind of like bone. She doesn't look sickly. They're not flat. Next, we're gonna look at the muscle tone. So I'm gonna go ahead and just use passive movement, and I guess the resistance to passive movement, okay? So I'm gonna go ahead and grab your arm like this, and then just kind of let me move your arm around, okay? We're just doing this to look at your muscle tone and that range of motion of your arm, all right? We're gonna test muscle strength. This is when we ask the patient to actively resist any kind of movement that we provide. It's gonna be tested on a grade from 0 to 5. So our patient who's pretty much normal is gonna usually be at about a 5. It's always important to take into consideration age, sex, pain, as that can affect the muscle strength as well. So first we're gonna start with the deltoid, which is also shoulder abduction. So we're looking at your C-spine really, and that's gonna be C-spine 5 and 6. That's what we're looking at, okay? So all you have to do is, if you can stand up for me, you're just gonna bring your arms up and just resist my movement, okay? So go ahead. Okay, so yeah, she's at a 5. There's no resistance to active movement or to my movement with any kind of fatigue. To the elbows, so that's gonna test elbow flexion and extension. It's gonna be C-spine 5, 6, and 6, 7, and 8 when we extend. So basically all I need you to do is push and pull against my hands. So I think I'm gonna just grab your wrists like this, and I just want you to pull against me, okay? And then push. Perfect. Okay, again, that's at a 5. She has active movement against the full resistance without any fatigue. Now we're gonna move on to your wrists. So again, there's gonna be wrist flexion and extension. These are gonna be C-spine 6, 7, 8, and I think your radial nerve as well, okay? So what I'm gonna do is you're gonna make a fist, and then I'm just gonna push down, and you just push up against me, okay? Go ahead. Perfect. So again, you're at a 5 on our scale from 0 to 5. Next, we're gonna move on to finger extension and abduction. So again, this is gonna test our spinal column, C7, C8, the radial nerve, and for abduction, C8 and T1. So what you're gonna do is just gonna bring your arm out for me, and I'm gonna hold your wrist. And so for extension, all I need you to do is keep your fingers from going down as I push down on them, okay? Perfect. And then for abduction, keep your fingers spread, and I'm going to try to squeeze them together. So resist that movement. Okay, so again, she's at a 5 against full resistance. She has active movement with no evidence of fatigue. And again, we would do that bilaterally as well. To thumb abduction, so you're just going to place your hand upwards in this supinated position, and you just bring your thumb upwards, and I'm going to push against you, okay? All right, and then again, perfect, they're out of 5. So next we're gonna move on to hip flexion. So we can do this sitting, you're fine that way. I'm gonna place my hands mid-thigh, and you're just gonna try to kind of lift up. And that's gonna look at L2, L3, L4. And this is both gonna be flexion and extension, okay? So again, I'm gonna push up against me. Perfect. So again, we're out of 5. Next, we're gonna move on to knee flexion. So you're gonna go ahead and lay supine for me. Yep, put your feet on the little couch. And what I want you to do is to keep your heel on the bed or the couch. And I'm just gonna try and pull up, okay? All right, next side. Perfect. Both are muscle strength. We're gonna look at the ankle dorsiflexion and plantar flexion. So all you have to do is push and pull against me, okay? And then again, this is also looking at L4, L5, and I believe S1. So go ahead and push. Okay, go ahead and pull. Awesome. Okay, and again, she's at a 5. So now we're gonna be testing coordination. We can do this many ways. The first way we're gonna do it is they're called rapid alternating movements. When we're assessing coordination, we're looking at the motor system, vestibular, the cerebellar, and the sensory system. So for our first rapid alternating movement, we're gonna do your arms. So you're gonna you're gonna flip for me, just like this, okay? As fast as you can. She's fast, smooth movements, they're fantastic. Next, we're gonna do rapid finger tapping. So basically, you're just gonna do this as fast as you can, both sides. And again, like the arms, she does have smoothness with the movements. Speed looks good. Which one's your dominant hand? Yeah, so normally sometimes the dominant hands can perform better than the non-dominant hand. For our coordination test, we are going to do point-to-point movements. So what you're gonna do is with your eyes closed, you're gonna take your index finger and you're going to touch your nose. Again, remember your eyes are closed, and you wanna move where your starting point is. So you can come up, higher, lower, from here. Okay, go ahead for me. Again, these movements are smooth. She's touching her nose every single time. Go ahead and move your elbows down, try that way. Perfect. Okay, so we're good there. Next, we're gonna do heel to shin test. So you're gonna go ahead and lay supine for me. And you're gonna take your heel on, this side, and you're gonna, come down just like that. Perfect, and then we'll do the opposite side as well. Remember, we're always testing bilaterally. Her movements are smooth, accurate. There's no issues with coordination here. Lastly, you're gonna test your gait. So we're gonna have you walk. So you're gonna come up in the sitting position. Perfect, just like that. If she needs to use her arms to push up, that's okay too. And if you want to cross your arms, you can. So what you're gonna do is you're gonna walk from here, go that way, and you're gonna come back. We're gonna look at your stance, we're looking at your posture, balance, and the smoothness of her gait. So go ahead, walk for me. We see she has a great posture. Go ahead, smooth movements, no issues with coordination or her gait. What you're gonna do is you're gonna again walk in a straight line, but we're gonna do this like it's a tandem. So you're just walking heel to toe. So you go for me. So great balance, posture still looks fine. Go ahead and come back. There we go. Okay, perfect. Again, smoothness with her walking. I'm in coordination. Last, we're gonna look at your position sense. So what you'll do for 30 seconds, well, for the sake of time, we'll only do 10, but it should be 30 seconds. Close your eyes and just stand for me. And again, here we're making sure there's no swaying. It's not abnormal for there to be swaying, but we want that to be minimal. And she does have a wonderful ability to keep a straight posture for her position. So next we're gonna test the sensory system. We're gonna do this through pain first. So we have tweezers here with a sharp end and a dull end. So you just tell me when you feel sharp or when you feel dull, okay? We'll do this on your upper and your lower extremities. So tell me if this is sharp or dull.
Sharp.
Yes. This side.
Sharp.
Here.
Sharp.
Mm-hmm.
Sharp.
Okay. We'll do again. What is this?
Dull.
Here.
Dull. Sharp. That's sharp.
Yes. It's sharp. This.
That's dull.
Uh-huh.
Dull. Dull.
Okay. Perfect. And did that all feel the same on each extremity?
Yes.
Okay. Perfect. So next we're gonna move on to temperature. So I have a tuning fork. You just tell me if this is cold or if it's hot, okay?
That's cold.
Yes, it's cold. How about on this side?
Colder.
And this one?
Cold.
And here?
Cold.
Okay. So yes, her sensory perception to temperature is intact as well. Next, we're gonna do light touch. So here I have a cotton ball. So you just tell me when you can feel this on your body, okay? Just go ahead.
Close my eyes.
Yes.
Oh.
Yes, close your eyes.
Now.
Mm-hmm.
Now.
How about here?
Now.
Here?
You're not touching me.
Nope. Okay.
No.
Here? This one?
Yes.
Here?
Yes.
Here?
Yes.
Here?
Yes.
Okay. Sweet. So light touch is intact as well. You also want to avoid callous skin. Test her ability to sense vibration with this tuning fork. So I'm going to hit this on the palm of my hand. I'm going to place it on the joint of one of your fingers. We'll do this again with your toes. You just tell me when you can feel the vibration, okay? Okay. And then we'll do it on the other, we would do it on the other side as well. We'll do it again on the feet, okay? So just tell me when you feel it.
Yes.
Okay, perfect. So her sense of vibration is intact. Okay, so next we're going to test for proprioception. This is also called joint sense. So we're going to grab the patient's big toe with my thumb and index finger, and you're just going to tell me if we're going up or if we're going down. Okay. So
Up,
okay,
down, down, and up.
okay, perfect. And then again, you would do this for the hands as well. Okay, so lastly, for our sensory test, we're going to test your discriminative sensations. So that's going to be with sterignosis, and that's just the ability to identify objects that we place in her hand. So I have 3, so you just tell me what they are, okay? So, all right, go ahead, open your hand. Can you tell me what that is?
That's a coin.
Yes. Okay, next.
That's a key.
Mm-hmm. And this one?
It's a rock.
Yes, perfect. Okay, so now we're gonna test your other hand again. Go ahead. Which one is that?
That's a key.
Mm-hmm. And this one?
That's a coin.
Yes. And lastly?
That's a rock.
Perfect. So this sense is intact as well. Moving on to the muscle reflexes, we're gonna start with the bicep reflex, and this is for dermatomes C5 and C6. So I'm just gonna place, you okay? Okay. You're gonna place I'm gonna take your elbow, hold it, put my finger on where your elbow bends. I'm gonna hit it, okay? And we're looking for the contraction of the bicep muscle. All right, so go ahead, hit. Yep, and we see, a slight contraction of that muscle. Next, we're moving on to the triceps reflex. So again, you're gonna have your arm partially bent, and I'm gonna hit the back, like right above the elbow, to see if we can get that tricep reflex, okay? So here, funky position. Okay, and yeah, we could see that reflex. Next, moving on to the brachioradialis reflex. That's gonna be dermatome C5 and C6. We're gonna have your hand kind of like this. We're just gonna hit right here, right above the wrist, okay? Nice little movement here. We do see the little baby reflex. Next, we're doing the quadricep or the patellar reflex. So we'll just have you sit. We're gonna hit right here on around the patella. Sitting is easier. You can do it supine, but again, sitting is easier. All right. So again, we're gonna do both. Oh yeah, and there's a little movement and a baby movement over there. Lastly, we're gonna do the Achilles reflex. So you'll stay seated like this. Yeah, perfect. And then I'm gonna hold your foot, and we're just gonna hit the back of the ankle. And yeah, so her reflexes are all present. And we're gonna test her abdominal reflex. We're gonna use the hammer, but we're gonna use this edge. So we're basically making an X towards the umbilicus. Per the book, I did read that it is hard to elicit this reflex. So we're gonna try our best and see what happens, okay? So here's the first one. No reflex. Nothing here. Nothing. Okay, so yeah, I wasn't able to get any kind of reflex, but hopefully that's not indicative of anything terrible. After the abdominal reflexes, we're also going to test your plantar response. So we'll use the exact same edge, and we're just going to go from heel to the bottom of the foot and just come right up, okay? See if you respond to this stimulus. Yeah. And then, yeah, the other one too. So yeah, she does have this plantar response. So now we'll be moving on to the next portion of the assessment, which is going to be musculoskeletal. First, so when we're looking at the musculoskeletal system, we're inspecting and we're looking at the range of motion. So first, we're going to start with the shoulders. So we're looking at the shoulder itself, the shoulder girdle, which consists of 3 different joints. We're also going to look at the scapula in the back here and any of the related muscles, both anterior and posteriorly. So upon inspection, there's no swelling, there's no deformities, there's none of those fasciculations of spine tremors, and there's no kind of like abnormal positioning that she has. So now we'll move on to range of motion. So we're gonna do flexion, extension, abduction, adduction, internal rotation, and external rotation, okay? So you can go ahead and stand up for me. And what we're gonna do is we're gonna start with flexion of that shoulder. So you're gonna just bring that arm up and then bring them both backwards. That's gonna, and all the way back, yeah, that's gonna be extension. And then you can put them back at the sides, and we're gonna bring them upward like this way. That's gonna be abduction, and adduction is gonna bring us back. And then so for our internal and external rotation, you're gonna come up this way. That's gonna be our external rotation, and internal rotation, you're gonna bring it actually back into the shoulder blade. Exactly, just like that. Perfect. So yeah, we see that your range of motion is completely intact for your shoulders. Looking at the elbows, we're gonna inspect the contours of the elbow, the exterior surfaces. We're gonna locate the olecranon and the epicondyles of the elbow as well. So I'm gonna go ahead and just feel for you. Yep, we feel the olecranon. We feel the epicondyles on both sides. So for range of motion, and there's no swelling, any kind of contours that are coming off as abnormal. So for extension, flexion, supination, pronation of the elbow, you're just gonna come flat for me, and then you're gonna come up, flexion, extension down, and then this will be pronation and supination, just like that. And yeah, she has the full range of motion. Inspect the hands, the fingers, and the wrists. So we're gonna do this when the hands are in motion and when they're at rest. We're gonna look at swelling, deformities, we're looking at angulation, we're looking at the thenar and hypothenar eminences. We're also gonna look at the flexor tendons like that. So I'm just gonna take a look at your hands, just keep them natural for me. Go ahead and flip for me. Perfect. I'm just gonna feel your hands also. And so upon inspection, the patient does have smooth, natural movements in her fingers. Again, just like that. There's no swelling, there's no deformities, there's no angulation. The thenar and the hypothenar eminences are not present, and there's no thickening in her fingers as well. So next we're gonna move on to the range of motion for your fingers in your wrists. So what we're gonna do is you're gonna keep your hands flat for me, just like this, and we're gonna point them upwards towards the ceiling. We're gonna go downwards towards the floor, and then we go back flat. Go ahead and turn them. Well, we go outwards for both, right? So that's gonna be abduction, and then adduction is gonna be inside. Keeping your wrist straight. And yeah, she does have the range of motion within her wrists. So after testing the range of motion for the wrists, we're going to test the range of motion for the fingers. So for flexion, you're going to take your hands, so bring your hands up for me. For flexion, we're just going to put our hands into a fist flexion, and then for extension, bringing them out as much as possible. Perfect. For abduction, we're going to bring our fingertips together and stretch as much as you can. Come together, that's adduction. So adduction, abduction. And then for our thumb, what we're gonna do to test flexion of the thumb is you're gonna take your thumbs towards the pinky and then back out. That's our extension. So flexion, extension. And then for abduction and adduction of the thumb, you have our thumb in that neutral position. We're gonna go outwards and in, out, in. Perfect. So yeah, so your range of motion for your fingers and your thumb are correct. We did this in the neuro exam. We're gonna also test in musculoskeletal the opposition of the thumb. So what you're gonna do is you're gonna take your hands up and with your thumb touch every fingertip. And we see that the opposition is intact. She did that with the rapid finger movements. Next, we're going to look at and inspect and look at the range of motion of the spine, which is gonna consist of the neck, the thoracic part of the spine, and the lumbosacral area. Upon inspection, you're doing this whenever you first see the patient. How they're sitting can tell you a lot. When we tested her neuro status and her gait, we saw that she did have an erect head, neck, and spine. There were no issues in terms of like her movement, her gait was very smooth. She has a great posture. But now we're gonna test the range of motion of the spine. So you can turn around now, so we're done looking at the spine. So we're gonna look at the neck, okay? So we're gonna test flexion, extension, rotation, and lateral bending. So for flexion, you're gonna touch your chin to your chest. And then now try and put your head as far back as possible. That's extension. So your chin all the way up to the ceiling. For rotation, we're just turning our head to the side, both ways. And then for lateral bending, you want your ears to touch your shoulders. Perfect. And then we'll move on to the next step. Test the thoracolumbrosacral part of the spine. And again, we're doing the same thing. We're doing flexion, extension, rotation, and lateral bending, okay? And then I'll help you with some of these actually. So you're gonna go ahead and just touch your toes for me. Perfect. And now we're gonna go ahead and stand up straight and scoot up just a smidge. Now I want you to bend back as far as possible, okay? And then I'm gonna hold you so you don't fall. Go ahead, stand. Okay, awesome. So rotation, again, I can stabilize if you need me to, but for rotation, we're actually twisting the body. Go ahead as much as you can. And then for lateral bending, I'll get out of the way. You're just going to touch the sides of your knees as far down as you can. Perfect. Okay, so we see that your spine range of motion, or at least the thoracolumbrosacral portion, is intact. Okay, so next we're going to inspect and assess the range of motion of your hips. So we're going to look at your gait, we're looking at your stance, we're looking at your swing, we're going to look at your pelvis shift, your stride length. We're also going to look at knee flexion when you're walking. We're going to be able to look at the hips anterior and posterior for any kind of bruising or atrophy. So I'm going to go ahead, stand up for me, and take a walk. So we see that she has a normal gait, the swing, stance, all look normal. The base width is 3 inches from the knee. Her knees were flexed as she was walking, and there's no signs of lordus or atrophy in your knees in that sacral spine. So next, we're going to, I'll have you lay down so we can actually inspect the front of the hips for any kind of muscle atrophy or bruising. So you can actually scoot down for me and have your feet touch the floor. We can look really quick. We see no bruising at all. There's no kind of atrophy or anything there. Hips look completely normal. And then can you actually go ahead and put your feet straight? So keep your legs straight for me. We see that the legs are symmetric and they're the same. So now we're testing the range of motion of the hips themselves, okay? So first we're gonna do flexion. So you can just, actually we'll get you supine. And what you're gonna do is you're just gonna bring your knees to your chest, okay? just like that. And then for extension, I'll have you go prone. So you're gonna lay on your belly and then keep your both knees bent, okay? And then lift that leg up. Beautiful. Other one, perfect. So range of motion for flexion and extension. And extension is normal. For abduction, we'll keep our feet and knees just like that. For abduction, you're gonna go away from the midline. So abduction, just like that, outwards. Perfect. And then adduction is we're gonna bring them inside, inward. Perfect. So last we have external and internal rotation. So I'll have you flip one more time to supine. And what we're gonna do is with your knees bent, I guess you can keep your knees bent. Yep, just like that. So that's gonna be our both internal and external on the right side. And we'll do the other side. So that's internal, external rotation, which is both intact for the inspect the knees and test their range of motion. So upon inspection, we see that there's the normal contours of the patella. These little bumps here are normal. That's just the bone itself. For inspection, we can also ask the patient to walk again, which we've already done, but we know that the patient, we've seen the patient walk many times, so we're not gonna ask you to walk again. But we're also going to look at, again, the swing and the stance when they do walk, which we already previously did. So next we're gonna we're gonna assess the range of motion. So this is just flexion and extension. So what you're gonna do is, so that they're bent already, what you're gonna do is extend, and then bend, extend and bend. And for the other side, extend, bend. So flexion and extension, again, range of motion. Lastly, we have ankles and feet. So again, we're inspecting the feet themselves and the ankles for deformities, nodules, corns, calluses. She has none of those. So we're gonna move on to the range of motion for this part of the body. So we're gonna do flexion and extension. Flexion, you're gonna point both your toes straight, and then extension, bring those feet up. Perfect. And then we're doing inversion and eversion. So inversion, yep, bring your ankles in. Eversion, bringing them outward, out, bring them out. So here,
That's really hard.
it is. So you're just coming outwards like that. Inversion, out. So we have a little trouble with the eversion. I don't know if that's just something she's incapable of doing or just a little bit difficult. But other than that, her other range of motions, flexion, extension, and inversion are intact and normal. And that concludes the end of the neuro and musculoskeletal assessment. Thank you so much for being my patient.